guys from doing. Once you hand me, so the last was dressings, right? But as you're counting, the only thing that should be left on your Mayo stand by the time you hand me these dressings, if you have to have anything, maybe a knife, pickup, and a Kelly, really. Everything, if you have to have something. My Mayo stands are usually naked with my dressings. But remember, you guys are still students, so if you have to have something on your Mayo, by the time I hand you back that monocryl, I should be looking over and this should be naked except for, like I said, maybe a knife, pickups, and a Kelly, if you have to have something. Okay? Mine's usually naked. I'm pretty sure yours is usually
wet and dry.
Wet and dry, yeah. Well, wet and dry and my dressings. So I want you to remove everything because I want them to see what we want to see. Okay? So just move everything back to your back table on log. Yep, take it all back. Yep, take this all back.
So on her case, let's see, she will have either a latex or a lap.
Per the
wet
book.
and a dry.
So per the book, real world, we do use latex. Per CST, Mr. P even brought this up to me and Ms. Abba that we have to use towels.
Towel.
Per the CST,
Okay.
you have to have one wet towel, one dry towel. Wet towel to wet to get off the blood that's left on the patient, and then a towel that's dry to pad it dry before our dressings come. So once her Mayo stand is empty, then we'll pick back up. But this is how we want you can move scissors up too, because sometimes if, like I said, if you have to have something, I don't like anything on my thing at the end. This is what you'll have. Also grab a towel. Nope, those are all done, remember?
Oh.
So you have a wet and a dry. So this is what I like. Good question. Where does your wet come from?
Clean saline.
This is how a lot of people.
Or water if you have water and it's clean.
Mhm. So doctor,
And if not, you will add another one.
yes.
Amen.
So this is how ideally we would like your Mayo stands to look before you hand us our dressing. If you have to have something. Like, I'm just keeping emphasizing that we're different people. Everybody does it different. Mine will look like this with my dressings, like Ms. Alba said. Wet, dry, my dressings. Students, we get it. Y'all still like to see something on your Mayo stand? Okay. For me, this is the minimal that I will accept, that I would like. Ms. Alba, what is the max you want on your Mayo stand? Like,
Wet and dry.
definitely wet. Wet.
A pair of scissors. You better take that knife off my Mayo stand.
Okay,
No
so-
sharps.
There you go.
A Kelly, sure. An Anson, sure. Like, I don't even really minimum like a scissor and just know where your sharp is and your
Mine looks
Anson.
like this.
And then your dressings. Yeah.
In dressings.
Yeah.
So it's on video. You know what our minimums are. By the time you hand us our wet and dry, I should be able to look over and be like, okay, cool. Because the next thing that we want to hear, are you done with your Bovie tip? A lot of times the doctors will just do like that. You still got to be accountable for this Bovie tip. Other times, hey doc, can I take your Bovie tip? Sure. And then you can take it off, or a lot of times they're like, sure, here you go. Okay? Immediately take that off your field. Now we can start, because now I'm getting my wet and dry. Now we're doing our last part of this group.
Assemble and apply dressings. Number 1, prepare flat abdominal dressing. That consists of Telfa 4x4s and abdominal pad, also known as an ABD pad.
So on a towel, per what they're saying.
Telfa 4x4s and abdominal pad.
Some 4x4s. The difference between the 4x4s, there's no radiopaque strip. Do not let a doctor say, can I just cut the strip off? I've had ENT doctors that try to do that, and I'm like, no, wait, we'll get you some regular sponges. Okay? And then your ABD is this. All right?
Pass flat abdominal dressing to surgeon on sterile cloth towel.
That's how you give it. So I'm coming back. Remember, I'm gowned and gloved. I've already had my dry, I have my towel. Thanks. Mr. P likes that, so.
Number 2.
So that's that one. You guys got that one? You guys know why the blue towel is over? What's the first thing that the patient's family sees once they come out, no matter how good or bad the case is? If they see blood on the dressing, they're gonna automatically think, what happened, what went wrong? So we tend to do this just to, when the drapes come down, your dressing is still good. All right, so that's the first one. You put this one back.
We still doing Montgomery straps?
We don't have any.
Okay. So I'll just, number 2, prepare fluff dressing on sterile cloth towel.
So for your fluff, and I'm only gonna just do one because we don't have, so for fluffs, all you're doing is just like fluffing it. And then you'll have a pile like this,
The whole package.
like that. So you'll have a whole bunch of, this whole pack fluffed. So for this lab, for Concord, I want you kind of, make sure you do a fluff. This is gonna let us know that the rest are fluffed. If you don't have this like this, me and Ms. Ob and Ms. D are gonna know you did not have the whole pack fluffed, okay? So, fluffed one, put the whole pack, and then you're gonna pass it up. Thank you.
Ideally, open the towel.
Yeah.
So when you pass it, the doctor doesn't have to.
And then you guys are gonna get it. Muscle memory. Towel still goes down. Okay. Next one.
Number 3, prepare Curlix and Elastoplast
Which we don't.
in sterile cloth towel for compression limb dressing.
So now we're talking about ortho. In ortho, the plaster is pretty much what it is. That's off the field. That's you, Karina. Okay, so as my scrub, I want you to say, here's your Curlex. Our circulator has the rest of your dressings for that part. If you don't say that part, you're gonna get a mark off. Because that's letting us know, you know, that second part is unsterile. Yes.
Could you repeat that for me?
Yes. Make sure you got me. Okay, so for this Curlex part, Juvie is our scrub. Hey doc, here's your Curlex. The rest of your dressing, our circulator has, because that part's unsterile.
Thank you.
Number
You're welcome.
4, cut Steri-strips in half, remove paper. Then pass Steri-strips with ampule of mastisol on cloth towel with dressing forceps to surgeon.
So when you guys are first starting off, you just want to make sure that you get it right. And I'm not going to actually cut it. You guys will actually cut them. So you're going to cut it. I can cut it. We have enough? Oh, okay.
1,000.
Oh, okay. So I didn't know if we had.
Cut Steri-strips in half, remove paper.
So were they talking about moving the paper?
Pass Steri-strips with ampule of mastisol on cloth towel with dressing forceps
So then you need
to
some.
surgeon.
So you need some. You can use Athens.
Atson with teeth.
Which you
Most
already have up.
surgeons use.
Remember we said those things that you might need. If you notice, we've needed the scissors and we needed the Adsons. So you're missing your Steri-strips.
And bring this one.
Okay.
Notice the Steri-strips are placed sticky side up. Don't stick the Steri-strips to the blue towel. You will get the lint of the Steri-strip on the Steri-strip and it won't be adherent to the skin like it's supposed to.
So this goes down first to the surgeon, right? And then I normally kind of go like this so that they can have it. Yep, kind of like that, because then I'm. Okay. All right.
Any questions on that one? Number 5, prepare and pass opsite, also known as Tegaderm, dressing on cloth towel.
And then kind of look at your dressings. I'm not going to pass all of the towels the same way because this is small, so I don't need it huge, right?
You have a big one.
Which one?
You have a big 8 by whatever.
For that one, yeah. So like if I'm doing this small one, I'm passing it on a small one. But if I have this big, large one, that doesn't make, you know, so then you can actually kind of make it bigger. Okay? So just make sure you're passing it. And for something like this, to get it from your back table to your field, you're going to want to have to cover it unless you don't mind it flipping everywhere. All right? So remember, she said to have it open for me. Okay? So when you bring it over, here you go, Doc.
So why do you wrap?
Same thing. So it doesn't flip over. The towel's not flipping everywhere.
Also, sometimes you think you're closed and something happens, the surgeon might need to open back up, blood on the field, you're protecting the dressing and keeping it clean. That's why it's wrapped, yeah. Real world, a lot of times, surgeon will just take the thing, they want you to leave the towel in the mail stand, but because this says pass it on a towel, we're training you to pass it on a towel per the standard here and in the book.
Yep.
I was just asking because that one was like big, so it was like awkward to like unwrap.
Oh, yeah. But like she said, my towel is usually.
Great
my-
question.
Yeah. Good question.
More questions?
In the real world, do you have to wrap all of them, or can you just?
I just hand it.
over?
No.
We're going by the
Okay.
book.
Okay.
Because remember, we do real world, but real world's not going to pass that CST for you.
Yeah.
So we got to make sure you guys know exactly what the book says. Okay? Also, another thing that, just FYI, ask them if they want it. A lot of times they're like, no, you just hand it to me like this. But some docs, I do have docs that are like, yeah, go ahead. Kind of like, especially something like this, you'll see them do like that, or you give them this and they'll just say pull and vice versa. Okay? So that'll come with what you know in your surgeon.
Number 6,
Come back.
gauze packing / iodoform.
Ah,
Use
Perfect.
forceps to grasp end of gauze packing. Pass to surgeon.
nope. I need you to grab some rat tooth, preferably longer ones. All right, so I am you now. Can you please come around? Get your scissors. Can I have some scissors, please?
Towel or kidney basin?
Yep. Can you ring the kidney basin?
Notice Miss Roulex technique.
Nope. I gotta get rid of this thing. I usually do this. Can I cut it? Do we have enough?
Sure, you have enough for your wound.
The rest of that goes to who?
The patient.
Thank you.
Can I show you an alternative for
Yes.
delivering this?
The other way.
Hold it that way.
It goes.
It's easier for the tech to grab it out. So if your circulator's trying to hold it the other way, just say, hey, can you flip the bottle? And then it's all,
Let's just do the whole thing.
you can also just use your hands too.
Yeah, that's what I was
That's
doing
more
earlier.
fun.
And it smells good if you get the, never mind.
If you get the Xeroform one.
Yeah, this is just plain.
That is a plain packing. It's packed into a wound that's left open.
So you give it to the patient so that way they can redo it
Yeah.
later?
Yeah,
If they need to, yeah. The patient gets charged for the whole bottle anyway, so we might as well give it to them.
Oh, okay.
Yeah. Single-use item, 1 per patient.
can I get it with it on? Thanks.
So notice what Juvie's doing. You find the end of it and you give it to the surgeon.
And then that would go all the way down until we pack it and stuff it, and there you go.
Any questions about that one?
Thank you, Mr. Yu.
That is the end of your assessment. Any questions in general on this?
I don't understand what you're packing with those.
Open wound. There's a hole that we're packing.
Okay, and then you would remove them later.
Yes.
Okay.
Yeah, we refill them, take them out.
And
Try
the
to get them.
iodoform packing comes in different widths. That's probably a 1/4 inch or a 1/2 inch. They can come up to 1.5 inches wide depending on the wound.
Okay.
So as a tech, don't let your circulator give you a small one if we've got a big wound. We need a 1 inch or a 1.5 inch. And the doctor will tell us.
So when the doctor's suturing, they would have to leave a hole, so then you would
So
be
this
able
is
to
a,
pack
yes,
it? Got
yes,
it.
yes. Any other questions, ask them, okay?
Does that strip stuff come in a dissolvable form? No.
Not that I know of,
Nope,
no.
I've never seen
It's
it.
pulled out post-op
I like that.
and then maybe reapplied depending on the wound and how it's healing.
What do you guys notice about my stance?
Your arms are always up?
Ah.
But,
So,
yeah, no, go ahead. You're fine.
I was like,
You're in a
surgical
gown,
con-
right?
I'm in a gown. But instinctively, because I'm not in a gown,
That's the
so you
point I
guys
was
get that,
giving.
right? Instinctively, I'm in a gown, but instinctively, I know that I'm not in a gown. My surgical conscience is always like, okay, wait, I can't just be, even doing that, I'm like, I can't believe I just did that. All
Her
right?
hand shouldn't be on herself because if we look at her, she's not in a gown. So if her hands are on her belly, her hands are now contaminated because she just opened glove.
And how much more comfortable do you do? How do you feel?
What do I do?
No, how much more comfortable do you feel now
Oh.
since before? And the reason I bring that is when you guys first come to the OR, you guys are like robots. And I noticed in the beginning you were robotic. Towards the middle, by the second,
Towards the end of
towards
the
the
counting.
end, you became more
more
fluid,
relaxed.
more comfortable. This is your field too, okay? Get in here. I mean, I'm real, like, when I dropped it, I did it extremely big so people could see. In the real world, it's like a slide. Like, you don't even realize it. I'm quick to be like, hey doc, I'm missing something. Doc, do you have, hey doc, you know? Get comfortable in uncomfortable situations. It's uncomfortable because they're doctors, right? They put on their pants just like we do.
They're human.
Yep.
And if you feel that you're like missing something, can you ask your circulator to like check
Yes.
it for?
Hey, Karina, I can't find this Ratex. Can you check before we get this count started? Can you just look?
And then they'll just.
Now then you're scanning. Because remember, Juvie is limited to what's blue.
And Juvy's scanning with her eyes on her side, but Karina, she can't see where Karina can go on the other side.
And then sometimes, like I like things to fall so you can see, okay? Normal. Like I don't like to, like if I'm gonna show you guys, of course I'm gonna make it extremely like look, you know? Don't let me touch this. Don't let me, good job. Don't let us do that. Because we're training you guys to even, gotta multitask.
Call it out.
Yep.
And say, oh, doctor, you're contaminated now. Let me change her glove.
Yep.
Oh, doctor, I'm contaminated. I gotta go re-scrub.
Yep.